Good morning.
Good morning.
Welcome, everyone. Welcome to our table talk here on this glorious April 27th. We um we had our last table talk going over mental health statistics and resources. We had an awesome special guest, Pedro Domingo, graced us with his presence and kind of went over some of those statistics and what some of those surveys mean, what do those numbers mean to us and our grants. So we're going to do a little recap of that and go over some resources, that we could find to help with, some of the numbers we see coming from those surveys. So thank you all for being here.
Yeah, huge thank you to Pedro and the Strategies program for guiding us through that. Pedro in that program's always been supportive. You guys know Pedro. Pedro helped out with the wellness conference, and that was a great experience this last weekend, right? That was
Yeah,
pretty
that was
cool that
amazing.
they included us in that wellness and recovery weekend. Those of you that saw us out there, it was great to see you guys. I wore my shirt yesterday. I got a lot of compliments on my shirt. I
Awesome.
noticed the sooner you wear your shirt, the sooner you're gonna wear your shirt. If you kind of tuck it away in the closet, it's harder to wear your shirt. But anyways, beside the point. Shout out to Pedro for helping us with the statistics and all the statistics that we came up with during our presentation. You guys can actually hear more about it on our podcasts.
Mhm.
Pedro joined us for our podcast where we talked a lot about the mental health statistics from the California Healthy Kids Survey and the SAMHSA surveys where we got the information. And I think you guys got to admit it was a lot more interesting. This month was a lot more interesting than you may have anticipated. Talking numbers and surveys and resources. What do you think?
Yeah, it was great to see how when Pedro was on, how actually broke down what a percentage is and where it
Mhm.
comes from. Like George was saying on the on the healthy resources, he really kind of broke it down for us and really showed us exactly what and where those numbers come from. So, like I said, I learned a lot this last month as far as getting those numbers broke down.
And just thinking like how important that survey is. How do we get this information if we don't do a survey? What other options are there to see like, what's working, what's not working, what is more impactful and, it's hard to get that kind of response out through the community other than a survey.
Right? I mean, nobody likes doing them, but at the end of the day, I think, and that's something that we've learned. We did this up and down our reservations. We did this discussion and this presentation, and for the most part, people understand now. Like, that it's just part of what we do. Nobody likes doing them, but we understand why we do them. We
Mhm.
used to think People used to think that we had this secret government objective to
Yeah.
get all their information, right? And that's why we kind of joke sometimes, like, "Hey, we need your serial number, your credit card, and your social security number," and it's kind of the running joke. But really, people understand now that it's just a formality, and this is the way that we just kind of keep up to date and keep our programs, current, and our funding going down the areas that may need it the most.
Mhm.
Um, with that being said, I think it was surprising that a lot of the youth were in sharing some of the statistics were dialed in and actually interested in the statistics. One of the big numbers that we shared throughout the month, without overwhelming a lot of people with the numbers,
Mhm.
was the talking about being sad. How many of our youth were sad over the course of a month? And it was roughly about 30% of our older youth, about 11th graders, about 30%, were sad in the last month.
Mhm.
And then as we had the discussion, people were kind of like, yeah, you know, a lot of kids said, higher numbers like 50, 80%. And it's like, wow. And that started the discussion, wow, 80%. Why would you say 80%? And then it's kind of like, it's been rough. It's been rough. And then we had to remind them that this survey was pre-COVID, and the post-COVID statistics. And, we talked a little bit about that during our table talk. If you want some more information on our information, it's on there. But we talked about pre-COVID and post-COVID, and what mental health has looked like, and the kids kind of led that discussion. And Jason, you heard some of these discussions, and they're talking about chronic sadness being or being sad. Most kids have probably dealt with really difficult times. How tough it was going on Zoom, and how frustrating it was, and how like nobody knew what they were doing. And it was like, you don't know if one day you were sick, or one day you had to go to school, or one day not knowing was super depressing. And then hearing their feedback was eye-opening for myself. As we move into talking about the statistics, as sadness and untreated depression just gets worse. And then the second statistic we talked about, which we talked about three throughout the month, the three that we focused on this month was chronic sadness in the last month, or sorry, sadness, kids that have been sad in the last month. Okay. And this is local statistics. Okay.
Right.
And all races, but we focused on Native American youth. And then how many youth have felt sad in the last month. And then we went into how many had a major depressive episode. Okay, which meant like almost like you couldn't go to school, or you were basically
nothing you were doing was enjoyable.
Right. And a lot of times when we talk, on our mental health first aid, did it affect your relationship? Did it reflect your day-to-day work or school? And did it reflect your work, school, relationship?
Yeah.
Okay. So, and then the last statistic that we covered was how many youth used alcohol or drugs in the last month. So you could kind of see how it trends into not feeling good, totally depressed, drugs and alcohol. And I don't mean to say that they all are gonna, once you're sad, you're gonna use drugs, but us being in the field understand it, without the right attention and treatment, and you guys help me out here, without the right help and treatment and intervention, that one thing could lead to another, right?
Absolutely. As long as they're catching it in time and continuing with the treatment plan, obviously you got to go see your physician, and then your physician can direct you in the other spots that you need it. But it's absolutely treatable.
And it's that intervention portion that, some programs like us, the PEI, program, tries to get, and help with those warning signs and kind of aid you in the right direction and point you on, who to talk about. Because, our talk with, because, it can be scary for people to kind of realize like, oh, maybe my child is experiencing this, but, I don't know what to do. So, programs like ours definitely really try to help aid them in the right direction and seek those resources that are, we need.
Right. The just to cover the last one, 30% of youth tried drugs or alcohol in the last month. So that was, to me, an alarming statistic. Youth thought it was a lot more, and again, these are pre-COVID statistics due to the fact that the California Healthy Kids Survey only comes out every 3 or 4 years. The new one is due to come out in the next year. We're going to see these statistics, which I'm really curious about. But we're hearing that like vaping and tobacco use is skyrocketing.
Mm.
Okay, skyrocketing, and we're curious to see, and the kids are all tell us. The kids will say that like everybody's vaping. That's what you hear say. It's everywhere. Teachers will tell us that. So you
Oh.
wonder the impact that COVID's had on our mental
Mhm.
health. And not just with our youth, with everybody.
Yeah. We
So it's been an
definitely.
interesting discussion. It's been a really, really interesting month. I think the fact that we're going to get into Mental Health Month in May and talk a lot about mental health is right on pace. So I'm actually looking forward to talking a little bit more about some hope
Hmm.
and some intervention. But we got some resources that we want to share, right?
Yeah, for sure. So, we always look to NAMI. That is a national um, association of mental illness. They're a great resource to have, and they always post up statistics on, what's going on in the mental health world. Um, you can Google them. They have an awesome website with a bunch of resources that they can go help you with, and they're very descriptive too on if you're wanting to learn more on a certain diagnosis or a certain mental illness. They definitely can help, and their number is 619-543-1434, and that's namesandiego.org. Another resource is San Diego Access and Crisis Line. I believe they're 24/7, George.
Oh yeah, oh yeah. This
Yeah.
is a really big one, especially if um, this is a number that we share with everybody: Native
Hmm.
American, non-Native, lineals, family members, all ages. This is a number where you can get advice if you're trying to help somebody. This is advice for helping somebody if you're in a crisis, if you're thinking of suicide, if you're contemplating any type of mental state that you're in. This is a number that's open 24/7. Hint the number here,
Hmm.
724. This is the San Diego Access and Crisis Line, and they could actually help you with resources as well.
And I always suggest too, if you want to just call just to get information, just to kind of see what their process is, if that's something you're interested in going to help another, just to kind of get a feel for how they work, and if that's the right, information you want to get. Um, we always advertise 211 as a good resource to get information. They do provide a lot, and they can even go as specific as to certain providers in your area. So definitely a good option to have and look up. And another one I want to mention is the mental health systems. They have a bunch of them out in North County, San Diego, as well as all around San Diego County. But they do offer a lot of mental health assistance, and I believe they're pretty much open to all medical insurances, which I know could be a big issue in seeking help. The needs there, but it's becoming a kind of an issue with trying to schedule appointments and stuff like that. So you definitely
Right.
want to do your research and try and get those numbers down, and maybe talk with people, see if they have referrals for you on who's the best to be seen if for some reason you're unable to come to the clinic. Which
It's
of
kind
course
of
brings me to my other one.
yeah.
Oh, go
Go
ahead,
ahead.
George.
Go ahead, please.
Which of course brings us to our IHC clinic. We're here for mental health services. Dial number 760-749-1410. We are option 4, and schedule your appointments. They're always willing to, speak with you guys and help out as much as they can when available.
And more we're finding our local reservations are having resources, and these things are constantly updating and becoming more and more current. Check with
Hmm.
your local reservation. Check with your local tribal hall, with your local contact. your Avelica program, your your local social worker, your community liaison, or your tribal contact, your tribal secretary, because there's tons of resources every tribe is taking mental health seriously.
Mm.
And we're finding slowly but surely. I found a ton of resources at the wellness conference this weekend. And it's super empowering to hear that people are really starting to focus on the mental health of our community. Because it's important. It's really important. We're seeing all these numbers. We've always seen these numbers. We've heard for years like suicide is like the second leading cause of death. And that's really, to me, it was really intimidating. It's really scary to approach that topic if it's such a high rate,
Mm-hmm.
because people don't like to talk about it. And to
Right.
me, if you're not talking about it, you're not addressing it, which is
Mm-hmm.
really gonna be hard to combat something, because education's important. You got to know what the problem is if you want to
Mm-hmm.
fix it, and
Right.
and that's part of it. It's not always about going in and getting therapy, or going to get help. Part of it is just learning. Okay, what is going on with my child? What are they dealing with? What are these warning signs? Or what are some resources? Or what are some ways that they can cope with what they're dealing with? What are some ways to relieve stress? And just finding local resources in your community, finding people that you can turn to, programs you can get into,
Mm-hmm.
because there's more and more people that are actually getting help. So it's actually going to start getting harder and harder to get into some of these resources. So the more creative you can be on your end to get out. They say 20 minutes in the sun. They say 20 minutes in the sun, which I believe. But I don't have the evidence in front of me to show you, or the
I think
the
Jason
statistics.
does.
Yeah, that's why I got all so dark.
Yeah, right. So just being resourceful on your own end, because we could shoot statistics at you until it kind of gets depressing in itself, and show
Mm-hmm.
you how difficult it is for our youth, or for ourselves as parents and adults, or for our seniors, and some of the obstacles our seniors with, dealing with healthcare, or pharmaceutical issues, and things like that. I mean, the statistics are always out there, and the numbers could go either way. They can be positive or negative. But
Mm-hmm.
if to me, it's really about resources, and how are you accessing and creating your own resources to make your life, to thrive, to really
Mm-hmm.
kind of create a life for you to be able to function and manage and enjoy, because you could really be positive or negative, because it's hard. It's hard,
Mm-hmm.
and we're all finding out. We're starting to come through this, the COVID situation, and we're kind of getting into these financial straits. I'm sure all of us are dealing with, so we're all looking for more and more resources, but yeah, so it's
So
just
also, it's that's why we stress so much about your resources, and we give you these numbers and emails. So it's really important to continue to check those numbers, because sometimes they'll change, but the last thing you want is to get a number and then have a loved one ready to go in. Well, you want to have that number updated and ready to go, so when your loved one is might be going through a crisis, you know where to go.
Mm-hmm.
yeah. And that's one of the big things when we teach the QPR steps, and that's the suicide prevention tool: question, persuade, and refer. That's a huge resource that we teach out in the community. If your community needs that, or if suicide's impacted you, your family, or your community, we can help you. We can come out and talk about that. We could talk about how to help somebody, how you can be a resource, or what we call a gatekeeper. But what Jason said is exactly right. When you're when you want to help somebody, or when somebody's looking to get help, be ready.
Mm-hmm.
Be ready, because they're not always going to be willing or ready when you're ready, but when they're ready, be ready,
Yeah.
because it's going to be time for them to go. I know that sounded super confusing, and Jason would say that from day one. you know, and I really understand that now because, you know, a lot of these resources are 8 to 4, 8 to 5,
Yes.
you know, and a lot of times people aren't ready till it's dark, you know, and what I mean by dark are times are rough, you know, and that road has come to an end, and there's nothing open, there's nothing going on, you know. And does that mean, you know, 911, or does that mean, you know, the cousin that they trust, or whatever that is, because, you know, we're trying to save lives here. You're trying to help people, you know, and get them out of these statistics,
Mm-hmm.
right, Jay?
Yes. It's
Thank,
important.
yeah, thank you for bringing that up, George. I did want to mention that, after hours care can be hard to get, especially if, you may be going through a crisis or, one of those episodes. So I do want to mention that there are crisis centers out in North County as well as, all of San Diego. So definitely look them up. They're open 24 hours and they do have, a psych eval on their staff, a psychiatrist, and they're more there for crisis situations, kind of like PERT team, but not as that's more of a kind of like a walk-in. So if there ever is a need, they have these crisis stabilization centers available to people who can, just go in and kind of get stabilized, or if you need someone to talk to, if you feel like you are in a crisis, that is, a good resource to look up and look into.
Yeah.
Yes.
Wait
You know, I
times
think
could be horrible.
I think just in closing, just to close this month, talking statistics, the idea was just for us to be uh, be humble, and I guess understand that it could be us, it could be me, or it can be our child that's dealing with these issues. A lot of times we say, you know, they're just going through it, or, you know, that just happens to them, or that's something
Mhm.
that we see in the media, you know. And when we share these statistics, it's not just to ooh and ah, it's that they're real life statistics, and these statistics that we brought are here close to home, and there are youth, and there are families, you know, our families that we care about, and it's not to expose us, it's more for us to look at each other and say, okay, these are things that we're dealing with, and we're sharing resources that are in the community. And a lot of these resources, yeah, yep, they're being maximized, and they're hard to access, but they're there. And just do your due diligence. If you're seeing these warning signs, or if you're seeing some issues, if you're seeing, you know, if your gut's telling you something, you know, follow through with it, you know,
Mhm.
because again, untreated sadness leads to depression, and depression can lead to, you know, untreated depression gets worse, and these kids start getting, you know, going through really difficult times. You see grades start dropping, you see attitude,
Self-medicating.
self-medicating, you know,
Mhm.
substance abuse issues, you know. And then we're talking about a life of addiction, you know. And we've all been through this, and now as adults we look back and we give our kids advice because we love them and we care about them. We don't want them to go through what we go through, and that's why we look at these statistics and say, you know, it could happen, it could happen, it could happen, and it's true,
Yeah.
you know. And that's our kids right now that we're looking through, and that's why we wanted to share this, is just to make it real, not so much as just to say it, but also to say, this is the proof, these are the facts, you know. We've done the research, you know, the evidence is there, the
Mhm.
professionals and the scientists have done the study, and our kids are being impacted, you know. And we have resources that are available, and the kids can make it out of it. It's not a death sentence to get in. Having a mental illness, or dealing with a mental health issue, isn't a life curse. It doesn't mean your whole life is messed up. Most of us have a mental health issue.
Mhm.
Most of us go through it, or
We just
going
learn how
through
to
it,
deal with it, and just like continue
right?
daily life. Yeah.
Right? It's how you cope. It's
Mhm.
how you cope, you know. And some of us have chose, you know, drugs and alcohol. Some of us have chosen, you know, a more positive method, you know. And you know, a lot of I'm going to guarantee that most of us have found a person, a person that intervened in our life and said, this is the right way, this is the positive way, this is how I did it.
Mm.
You know, we did a presentation yesterday, and we talked about lived experiences. It's like, you know, so a lot of times people listen more, with all due respect to the experts and the doctors in the field that have put their lives, in the education field, that they're very important. Our goal is to get people to them, but it's the people that have lived the experience, our uncles and aunts, that take time to care and say, look, I've made it into recovery and I care about you now. And I don't want to see you be another statistic. Most of us don't make it out of here. I want to
Mhm.
see you succeed. I want to see you go to school. I want to see you become, I want to see you get on the crew, or lead, or be a manager, or be a leader, or be what you want to be,
Right.
and I think though, being somebody that's lived that experience, and then taking the initiative to be a leader and share, I think is a resource in itself, and that's kind of why we did all this,
And I feel we
is
need more of that peer support, just to have on hand for, just as me as a case manager for our resources. Like,
be
hey, I know we can't get you help right now, this day, but here's some people who could maybe you could talk to, peer support, gone through it, and maybe can just give you some tips and, some helpful information while you're waiting through this process of getting seen, just that kind of inner middleman to help with the process and kind of guide them,
because let's be honest. I mean, it can be difficult accessing these resources.
it could take months, and
you,
that's
you, the hotlines, I'll say the hotlines that you shared, they're accessible, and they're extremely, the research shows they're
Mhm.
extremely helpful.
Yes.
The access and crisis line, Optimum, the San Diego crisis line, those are extremely helpful, and they're like right now they even have like text lines,
Mhm.
but you know bringing somebody in and getting them help, especially if they're in a crisis, is extreme. You could save somebody's life, but there's a chance. It's true. We hear it all the time. I went in there and I couldn't get seen. That's a reality.
Mhm.
But the fact that you spent the time with them and took them is probably what could have got them through that difficult time.
Right.
It's the people that care. And that's kind of why we wanted to talk about the resources and things like that.
We have a question. I don't know if Art can pop it up. Art is our back guy today. Um, there's great power and reward in being a mentor to others who are struggling with things that you've been through. Definitely. There is great power, and it can definitely help, those individuals that are in crisis or, kind of don't know what to do.
Oh yeah.
What's next?
And the same, the shoes on the other foot. All of the youth out there that are being, walking that road and keeping their head up. You guys inspire us to keep doing what we're doing.
For sure.
And we work really hard to be good role models for our youth too, for our young leaders that are getting into adulthood and making tough decisions and trying to figure out which way to go. It's not easy out there, but hey, there's people here to help you. There's people here that care,
Mhm.
and you'll be all right.
Right.
Get
And I just wanted
involved.
to clarify real quick. When I said it'd be a wait time, like 1 to 2 months, I meant that maybe trying to seek your own counselor, with the many people wanting to get services, there can be a wait time. So
Sure.
definitely wanting to get something in the works during that wait time.
Generally, there'll be a wait time, and then you like get on a wait list, and then it could happen like kind of like the dentist. You get on a wait
Right.
list, your appointment might be later in May, and then boom, they'll call you tomorrow.
Right.
It could be like that. Or
Definitely.
or or once you get established, then things become regular.
So just definitely prepare yourself for those, those instances that may happen. And I know
Right.
they could be a down, a bummer. It can be a like darn it type of thing, but just definitely stay in there and keep getting that service and making those calls because you guys are, you're your biggest advocate, and definitely stay on top of getting the help.
Yeah. So next month
Um,
is Mental Health Month. This is where we're gonna shine.
All right.
Yeah,
We're gonna
bring our A
try.
game. We're gonna bring our A game. Mental
Nice.
Health Month.
sounds good.
So stay tuned, guys, and I believe that concludes our top table talk for the April month. So thank you all for tuning in. Tune into those podcasts, and we will see you next month for Mental Health Awareness Month. Is that what that is, George?
Yep.
Yes.
Awesome. All right, stay tuned.
Sounds
Thank
good.
you, guys.
Let's
All
see you
right.
guys.
Thanks.